we have a series of programs coming up on corporate well-being, and this is the first program we are presenting, that is screen apnea. We'll come to know what it is as we go ahead with the session. These are all the programs we plan to do, and these are all the important programs coming up in future. Definitely we'll be doing a lot of these programs, and we are going with the first program here, that is breathing while emailing. This is what the first topic we are taking today. So breathing while emailing, what is this email apnea or the screen apnea we mentioned? The habit of temporarily suspending one's breath when engaged with a screen. That is called screen apnea or email apnea. So if they say if you're feeling fatigued and stressed out at work, always check how's your breathing. Okay, so it all started with this New York Times article written by Alicia Gupta. So the heading was checking email, you are probably not breathing. So I'm going to the details of the article, and it is available online for you to see. The article mentions about Linda Stone, a former Microsoft executive. She was a practitioner of breathing techniques, and every day she used to practice breathing techniques. But whenever she opened her laptop to check on the emails and messages, she found that she almost stopped breathing. She was not breathing at all, or it was very, very shallow breathing. So then she thought, like, am I the only one, or there are others who have the same problem? So she invited 200 people for her study. It was an informal study, and where she monitored their breathing pattern and also the heart rate while they checked their emails or messages. What she found was 80% of the population, 80% of the people who participated had email apnea or screen apnea. That is, they were holding their breath or stopping their breath when they were checking their emails or messages. Mind you, this is only the email and messages where you need to respond. That is where it is called email apnea or screen apnea, not for the movies and other programs. So even in 2020 book, Breath, the New Science of Lost Art, it is mentioned that the issue has become more likely worsened with our increased use of screens. And they also say that you have 10 different screens open. Someone is texting you, someone is calling you, someone is emailing you. And finally, they say that we have not evolved to be constantly stimulated. Few psychiatrists who specialize in autonomic nervous system, they say that screen apnea is a manifestation of our body's stress response. That means whenever you get a message or an email where you need to respond, body doesn't see as a message. It sees as a threat to the body, or there is a wild animal in front of you, and start producing all the symptoms of stress response that we'll talk about. That is as if, before catching a mouse, the cat freezes, and then after some time, it bounces on the cat and catches it. This is essentially what is happening when you get an email or message. You freeze, you read, and then come up with the action plan. This freezing is a problem. We'll see why it is a problem. And more so when you get an unexpected stimulus. For example, you're on a holiday, you get a message from your boss, and that is more likely the body is to perceive that as a threat. Some even say that that they have noticed screen apnea among patients who worked high stress jobs for long hours without getting much exercise or sleep. In the sense, sedentary lifestyle also could increase sleep apnea. So now simple practices you can adopt for better breathing habits. First is a gentle sounding alert, like every 1 hour you check yourself how you're breathing. Of course, we are going to go in depth about the breathing techniques. You'll be doing for almost 20-30 minutes with me. Just know this. So you can set up an alarm and check how you're breathing. If your breathing is not right, you can immediately correct your breathing. And second thing is ask yourself, and suddenly you remember that check yourself whether you're breathing properly or not. And then take 3 or 4 sleep, slow and deep nasal breaths through your nose, and that should solve the problem. And some people also suggest the sighing, like deep exhale, like so. In between, when you're checking emails or very cyclic sighing, also they say, which solves the issue. We'll come to that, all those things when we practice breathing techniques. And one more remedy they say is try to switch to a larger screen. They say as you narrow the visual field for a small screen, you increase the demand on your nervous system to exclude everything outside of it. And they also say responding to messages on a desktop monitor often feels easier than responding on a phone, which is more intensely focused. So try using your bigger monitor and try how you're breathing. So then try to reduce your screen time and avoid screen time during while eating or close to sleep. That's a common thing. And also they say one solution is make your breaks count. So what people often do is whenever they want to take a break from they checking their emails or laptop, they go to the phone and start checking their messages, which is not good. From one screen you're going to other screen, that is the sleep or the screen apnea continues. Instead they say listen to your music. What happens is when you listen to the music, so that your nervous system can switch from a state of focus and vigilance to that of relaxation. So listening to music in between is helpful. And also take a walk in nature. That also, it's a simple thing, but it helps a lot. So what we're talking about till now is uh, screen apnea. That means to say whenever you get a message or an email, you tend to hold your breath. That means you're not breathing. And it is unconscious, that you don't know about it, right? We call that as unconscious breath holding. So what happens when you hold the breath unconsciously? Whenever you hold the breath unconsciously, your sympathetic response in the body, that is the fight and flight response, is getting activated. That is a stress response. So there are two responses in the body to understand. One is the sympathetic, that is a flight and fight. And another is the parasympathetic, which is rest and relax. Both should be, balancing each other. But sometimes when you're checking about 40-50 emails a day, then the sympathetic response, that is the flight and fight response, will continue for the entire day. If you're checking 1 or 2 emails in a day, that's fine. But when you check a lot of mails and a lot of messages, you have to respond. That's when the problem starts. Okay. So what happens? You can see here, these are our body systems here, and these are the short-term and the long-term effects. When you have these 40-50 mails and you're not breathing properly over the period of probably 1 month, 2 months, what happens? Your pulse, that is the heart rate, will increase, blood pressure will increase. If that continues for 3, 4 years, 5 years, 10 years, then people may develop hypertension or irregular heartbeats. The respiratory, definitely there will be shallow breathing, and after 5-10 years, that is a chronic or the long-term phase, that will continue. Digestion part, initially it will stop or decrease, and that will become a habit, like people have constipation or flatulence. Liver, what does it do? Because whenever there is a stress response activated, liver always thinks that there is a wild animal in front of you and start producing more glucose, and blood sugars are always high. If people with diabetic and we have this something issue like a stress or a screen apnea, then the sugar levels are always high. And if you see genitourinary, then some people will have impotence, abnormal cycle, loss of libido. Brain, it just keep on focusing all the time, and people may develop decreased concentration, decreased memory, and it may go to depression as well. The muscle systems, the muscles in the body, the tonicity increases, and over a period of time that becomes muscle tension. People have neck pain, back pain. We say that is ergonomics, but most of the time it will be because of stress related factors. And this is last one is very important: blood clotting. The clotting factors are activated. That means the tendency to clot, and long term that may cause heart attack or the brain infarcts. All those things may cause. And also the mood also will vary. They will have anxiety, fear, lack of safety, overthinking, poor sleep, irritability. All those things will happen. because of the activated sympathetic response, that is the flight and fight response, that in turn is caused by not breathing properly, that is shallow breathing or not breathing at all. Now, this is what unconscious breath holding does. Now, let us see conscious breath holding. What does it do? So, what is this conscious breath holding? Till now, we realize some breath holding where it is not in our conscious. We didn't know that we are doing it. That is unconscious breath holding. It has bad effects on the body. But consciously, if you hold the breath, what happens? Of course, we'll do all this in a practical session that is planned and predictable. For example, somebody diving underwater or holding the breath for a false smell. This is called conscious breath holding. You know that you are holding the breath. Okay. Since it's a conscious effort, body responds in a different way. There is a different physiology altogether, a change in ultimate experience, which positively benefits the body. What are the benefits of conscious breath holding? Improves stress management, resilience, reduces inflammation in the body, increases immunity, and also increases the oxygen distribution. Why such different outcomes? So one is the unconscious breath holding, like screen apnea, and other is the conscious breath holding. In both of the things, you are holding the breath. Only difference is one is consciously doing, other one is unconscious. So what happens when you do that? Conscious choice, and when we have a desire to do anything, in this example, holding a breath, dramatically changes the body response, changes the interpretation of that event. So whatever, not only the breath, whatever you do with full attention, full concentration, and you should have a desire to do it, then the outcome is different than if you are forced to do it or you're doing involuntarily. It's quite different. So consciously do any activity that is beneficial for the body. I'll explain to you with a beautiful example. So this line says the ability to consciously decide how we want to feel in any given moment is possibly the greatest human gift. I think the humans only humans have this gift to consciously decide whether we want to be sad or happy. I'll teach you how to do it. It's very simple. Follow the breathing techniques. You can be happy wherever you are. Now, I spoke about the conscious choice. If you do consciously something, how it benefits the body. Here it says, this is from the book Harvard Business Review on Managing Yourself. Matthew Lang is a MD of Sony in South Africa. He says he takes 20-minute walk in the afternoon. He says walk for 20 minutes in the afternoon. He says it is a mental and emotional breather. Plus, it's an exercise as well. And further, he says he get creative ideas while walking. How? He further says he get creative ideas because the mind is not actively thinking. We always think that the mind is where we get creative ideas, but no, mind is not getting creative ideas. In this activity is going beyond mind. Beyond mind is where the true happiness, and that is where you have the creative ideas. So how to get it? In this example, he did a conscious walking. That means he was walking with full attention on his walk. He was not thinking something or talking with the phone and walking. He was walking with attention. That is where he could go beyond mind. That is where the real happiness, or that is where you get creative ideas. And one more way we can get that is the conscious breathing as well. So what I'm trying to say is, consciously if you do something, it is beneficial to the body than doing something unconsciously. Now, let us see breath. Okay, so why we are doing breath awareness meditation here, breath awareness sessions here is, one is to find a solution for screen apnea, because you are doing unconscious breath holding in screen apnea. So it's very important for you to learn what is the right way of breathing and then how to utilize it to overcome screen apnea. Okay. Now, breath awareness meditation. So first thing what you have to do is keep one hand on the chest. You can do it with me. One hand on the chest and one hand on the abdomen. And observe while you are breathing, which hand moves more compared to the other. Whether the hand on chest breathing or hand on the abdomen moving. So just observe for 10 seconds. Then we can speak. Which hand moves more compared to the other? Of course, both moves, but which moves more compared to the other? while you are breathing. You can just see and know. Okay. So whenever we ask in the class in a session, about 60% of the people will say hand on the abdomen is moving more compared to the chest, and 40% say hand on the chest moving. So what is the right way of breathing? The right way of breathing is hand on the abdomen moving. That is the right way of breathing. Why? Let's see. See, whenever the hand on the abdomen moves, that means the belly comes out, it pulls the diaphragm here, and the air comes in. And when the belly moves back, it pushes the diaphragm and the air comes out. Okay, this is called abdomen breathing because abdomen is involved, or in layman terms, we can always say that it is as belly breathing, or since diaphragm is involved, diaphragm is the organ between the lungs and the abdomen. Since diaphragm is involved, we call it as diaphragmatic breathing. You can call any of the terms. What happens here is when we do abdominal breathing, the lower part of the lungs get involved. That means you get around 25 to 30% more oxygen compared to chest breathing. And one more advantage is whenever you do abdomen breathing, activating the diaphragm, the parasympathetic system gets activated. That is, the relaxing nerve gets activated. What happens when the relaxing nerve gets activated? Your heart rate becomes less, the mind will become calm, you can think better ahead, think ahead, mind is calm, and breathing is quite deep. So it has got a lot of advantages. The abdomen breathing is the right way of breathing. Let us do this abdomen breathing now. So keep one hand on the, you can keep one hand on the abdomen and take 3 deep breaths. At the end of third exhale, just close your eyes. At the end of third exhale, just close your eyes. And once you close your eyes, do not open the eyes until I tell you. Now start doing abdominal breathing. That is, whenever you take in air, the hand on the abdomen should come forward. When you breathe out, the hand on the abdomen should go back. When you breathe in, the hand on the abdomen should come forward. When you breathe out, the hand on the abdomen should go back. Your abdomen, think it as a balloon. You are inflating the balloon and deflating the balloon. And the breathing should be as slow as possible, as relaxed as possible. You're 100%. Breathing should be as slow as possible, as relaxed as possible. You're 100%. Should be a very much relaxed breathing. Breathing should be as slow as possible, as relaxed as possible. You're 100%. When you breathe in air, the hand on the abdomen should come forward. When you breathe out, the hand on the abdomen should go back. Breathing should be as slow as possible, as relaxed as possible. You're 100%. Do not force yourself. It should be a very much relaxed breathing. It should be a relaxed breathing. When you breathe in, the hand on the abdomen should come forward. When you breathe out, the hand on the abdomen should go back. It should be a relaxed breathing. Breathe as slow as possible. You are 100%. Breathe as slow as possible. You are 100%. Bring your attention to the breath. You can concentrate on the tip of the nose where the air is coming in and going out, or you can concentrate on the hand of the abdomen which is moving forward and backward. Your concentration should be only on the breath. Concentration should be only on the breath. Concentration should be only on the breath. There should not be a single breath which went in without your knowledge. There should not be a single breath which went in without your knowledge. Your concentration should be only on the breath. Notice, after some time, your mind just wanders away. But be gentle on the mind and bring it back onto the breath. Be gentle on the mind and bring it back onto the breath. Your concentration should be only on the breath. There should not be a single breath which went in without your knowledge. And breathe as slow as possible. You are 100%. It should be a relaxed breathing. It should be a relaxed breathing. Do not force yourself and ensure the hand on the abdomen should come forward, taking breath, and hand on the abdomen should go back while you exhale. Your concentration should be only on your breath. There should not be a single breath which went in without your knowledge. There should not be a single breath which went in without your knowledge. If your mind wanders away from breath, gently bring your mind back to the breath. Always know that mind wandering away is natural. Bring it back onto the breath. As slow as possible, as relaxed as possible. You're 100%. As slow as possible. Concentration should be only on the breath. Observe how the air is moving in and moving out at the tip of your nose. You can also observe the air going inside and the air coming outside. Whichever way you are comfortable, keep your awareness on the breath. As slow as possible, as relaxed as possible. As slow as possible. Concentration should be only on the breath. Again, if the mind wanders, be gentle on the mind and bring it back onto the breath. If the mind wanders away, bring it back onto the breath. Your concentration should be only on the breath. Either you can observe at the tip of the nose where air is going in or coming out, or on the hand of the abdomen moving forward and backward, or you can follow the air going inside and coming out. Just be with the breath. Breathe as slow as possible, as relaxed as possible. Last three breaths. After last three breaths, keep your eyes closed. Keep your eyes closed. Observe all the subtle changes happening in the body and mind. Observe all the subtle changes happening in your body and mind. Observe the happiness within you. Observe the relaxation within you. Enjoy this relaxation. Enjoy this happiness. Feel the relaxation within you. Feel the happiness within you. And feel the love within you. Feel the happiness within you. Feel love within you. And feel the relaxation within you. Feel the calmness within you. Feel the happiness within you. At the count of three, we'll be opening our eyes. Three, slowly come back. Two, be aware of the surroundings. And one, slowly open our eyes, feeling fantastic, better than before. Slowly open your eyes. You can rub your hands and give the heat to the eyes and face. You can get up for a few seconds. Stretch, look around. Stretch, look around. Stretch your arms, stretch your legs. Look up, look down, look sideways. Once you are comfortable, have your seat. So what we did now was the basic breathing technique called abdominal breathing. Okay, so we learned how it is useful and why it should be done. This is a normal breathing technique. If you observe babies, small babies, they breathe through their abdomen, right? You can see the baby's belly moving up and down. But as we grow, we tend to pick the wrong habit of breathing, that is chest breathing. Whenever if you're doing a chest breathing, just observe, for a few days, practice like what we did. And after a few weeks, it becomes your habit. You can change that. The chest breathing can be changed to abdomen breathing, which is the right way of breathing. Or if you want to tell somebody about breathing, just tell them how to breathe properly. And after a few weeks, they'll be a totally different person altogether. Because that calms the person down. When you start doing abdomen breathing, it calms the person down. And when you have to do this, you have to do this morning. Start with, morning 5 to 10 minutes in the morning, 5 to 10 minutes in the evening, and in between, whenever you feel like you can do. Always remember this breath is the greatest friend you can have. You don't want to do anything, just keep on breathing. You'll feel so relaxed. Or you are tensed, start breathing. In the middle of the night, you're not getting sleep. While lying down itself, you can start this abdominal breathing. You will get relaxed and you will sleep as well. So breath is the best friend what we can have. nothing to do, start uh, abdominal breathing. Breathing is the best friend you can have. Always try this wherever you are. You want to get relaxed, just do abdominal breathing. For example, whenever we go to hill station, we feel so good. Why? Because of the deep breath, what we have there, fresh air, that causes the relaxation. You can have it in your house itself. So breathing is your best friend. So always try to do whenever you have time. Just sit, close your eyes, and start breathing through your abdomen. You feel so much relaxed all the time. So in screen apnea, when you have to do, just before opening your mails, just do it for 2-3 minutes, and periodically, after maybe half an hour, just take 1 minute break and start doing abdominal breathing. Just 1 minute, that's enough. You'll come normal, your breathing will be aligned, and that becomes a habit as you go forward. So if somebody is doing chest breathing, what to do? Like we said, practice it, or you can, when you're lying down, you can just keep your book on the abdomen or a towel and keep on observing it going up and down. And after a few weeks, it becomes a habit. So abdominal breathing is the right way of breathing. Now, what is the second way of breathing? So what we did now was we inhaled and exhaled, took in air and put it out. We'll add something in between now. That is inhale, hold, then exhale, then hold. Breathe in, hold, breathe out, hold. We'll try to do this. And this will be in counts, not seconds. For example, breathe in for 6 counts. That counts will be the speed depends on your capability, your 100%, however you feel comfortable. Some want to do very fast, some can do very slowly. It depends on you, your 100%, but don't strain yourself again. So breathe in for 6 counts, hold for 3 counts. When you breathe in, hold the air for 3 counts. Then again, breathe out for 6 counts, hold for 3 counts, again breathe in. So breathe in, hold, breathe out, hold. 6, 3, 6, 3. That ratio has to be maintained, not the time. The time depends on whether you want to do it slow or fast, but the advice is do as slow as possible. Initially, you may not be able to do it, but as you practice, you'll be able to do it. And when you hold this 3 counts, this is what we call it as conscious breath hold. This is where you get all the advantages of conscious breath holding. Okay. In screen apnea, what we saw was unconscious breath holding. You're holding the breath without knowing. But here, it is conscious breath hold. This is a very, very simple but powerful technique. Let us start doing it. Now take 3 deep breaths, and at the end of third exhale, as you exhale, just close your eyes. At the end of third exhale, just close your eyes. I'll be giving counts for 2 cycles, and after that you have to give your own counts. Okay, ready? Breathe in 1, 2, 3, 4, 5, 6. Hold 1, 2, 3. Breathe out 1, 2, 3, 4, 5, 6. Hold 1, 2, 3. Breathe in 1, 2, 3, 4, 5, 6. Hold 1, 2, 3. Breathe out 1, 2, 3, 4, 5, 6. Hold 1, 2, 3. Breathe in, do your own counts. 6, 3, 6, 3. Do your own counts. 6 counts of breathe in, 3 counts of holding, again 6 counts of breathe out, and 3 counts of hold. Your concentration should be only on the counts. You should not miss your counts. Breathe as slow as possible, as relaxed as possible. It should be a very much relaxed breathing. It should be a very much relaxed breathing. Breathe as slow as possible, as relaxed as possible. You're 100%. 6, 3, 6, 3. The ratio should be maintained. Breathe as slow as possible, as relaxed as possible. You're 100%. It should be a very much relaxed breathing. The ratio should be maintained of 6-3-6-3. Breathe as slow as possible, as relaxed as possible. You are 100%. You should not miss your counts. The counts are very, very important. Remember, it is not seconds, it is just the counts, the ratio. Breathe as slow as possible, as relaxed as possible. You are 100%. Breathe as slow as possible, as relaxed as possible. You are 100%. Maintain the ratio 6-3-6-3. It should be a relaxed breathing. It should be a very much relaxed breathing. Do not force yourself. Try to breathe as slow as possible, as relaxed as possible. You're 100%. Your count should be, your concentration should be only on the counts. Your concentration should be only on the counts. 6-3-6-3. Strain yourself. You should be relaxed breathing. Breathe as slow as possible. You are 100%. Don't force yourself. As slow as possible, as relaxed as possible. You are 100%. 6-3-6-3. Concentration should be only on the counts. To be relaxed breathing. As slow as possible, as relaxed as possible. You're 100%. Your concentration should be only on the counts. If your mind wanders away, bring your mind back on the counts. Your concentration should be on the breath with the counts. Remember, all the time you have to do abdominal breathing only. If the mind wanders away, bring it back gently onto your breath. Last 3 cycles. After 3 cycles, keep your eyes closed and continue abdominal breathing. After 3 cycles, keep your eyes closed and continue abdominal breathing without counts. Observe all the changes happening in the body and mind. Observe all the subtle changes happening in your body and mind. Observe the relaxation within you. Observe the happiness within you. Observe calmness within you. Observe the relaxation within you. Enjoy this relaxation. Enjoy this happiness within you. Experience the love. Experience the calmness within you. Enjoy this happiness. Enjoy this relaxation. Enjoy this calmness within you. Enjoy this happiness. Enjoy this calmness within you. Feel the love within you. Count of three. You'll be opening your eyes. 3. Slowly come back. 2. Be aware of the surroundings. 1. Slowly open your eyes. Feeling fantastic, better than before. Just open your eyes. You can move around, rub your hands and give the heat to the eyes and face. You can get up from your seats, look around, look up, look down, stretch your legs, stretch your arms, turn around. So what we did was breathing with counts. That is 6-3-6-3. If you face any difficulty in counting, there is one more easier way. You can just say inhale, hold, exhale, hold. Why you have to do this kind of meditation? That is the conscious breath holding. This is where you get a lot of energy. Whenever you're in a meeting, you're feeling low. All you have to do is inhale, hold, exhale, hold. Try to do in that proportion of 6-3-6-3. But still, if you forget the counts, still you can do inhale, hold, exhale, hold. You get a lot of energy. You can see yourself that you get the instant bout of energy. So when you have to do this kind of meditation is morning 5 minutes, evening 5 minutes, and in between, whenever you feel low in energy, you have to do this kind of meditation. Especially while traveling. If you're not driving, then that is the best time to do it. All this meditations should not be done while driving. Okay, because sometimes you get very relaxed. That is not what we want in driving. Other times you can always do it. And all these meditations can be done with open eyes. It's not required for you to close your eyes. In a meeting, if you open your eyes and start doing this kind of breathing technique, nobody will know. But still you get a lot of energy. So we learned one technique of abdominal breathing. That is a normal way of breathing. Try to breathe as much as possible in that. Whenever you're free, try to do abdominal breathing. But this breath holding techniques, this one what we did just now, inhale, hold, exhale, hold, do it only 5 minutes in the morning, 5 minutes in the evening, and in between whenever you are low in energy. Okay, this is a very good techniques. Now for screen apnea, what is that you have to do? One is morning and evening techniques. You follow your regular practice, and just before opening your mails, just do abdominal breathing, and then open your mails. And every half an hour, 1 hour, you just go back to your abdominal breathing and start doing the proper breathing technique, and slowly that becomes a norm. Even if you see 10 messages or 1,000 messages, you still once you practice, you'll be breathing through your abdomen only. So practice makes perfect. Okay, so that's the end of the session. And if you have any questions, any doubts, you can ask me now.